Cystic Fibrosis Foundation Compass presents Navigating CF, a series of informational videos for people with CF, their families, and caregivers. This video presents an overview of types of health insurance that may be available to people with CF, especially when they may need to change their coverage. You'll find additional videos and more information in this Health Insurance for CF series on the Navigating CF playlist. There are two major categories of health insurance and several types of plans under each. Commercial insurance includes employer plans, COBRA, private plans, and the health insurance marketplace. Programs such as Medicare, Medicaid, CHIP, which is the Children's Health Insurance Plan, and others provide government-funded health insurance to qualifying individuals and families. Depending on your circumstance, you may be eligible for either commercial or public insurance, or both. Keep in mind that health insurance plans can have age limits. Medicaid and group health plans, such as a parent's employer plan, are two examples to be aware of, especially as people with CF transition into adulthood. Now, let's take a brief look at the different types of commercial and government insurance plans. If you have a job, or if your spouse or parent does, the employer may offer group health insurance coverage. In most cases, dependents can stay on a parent's plan only until they turn 26, but it's important to check with the plan directly and find out about options. When an employer contracts with an insurance company to pay claims, this is known as a fully funded plan. If the employer pays claims directly, it is called a self-funded plan. This is important because the two types of plans differ greatly in their flexibility and how appeals are handled, and this could impact coverage. So find out which type you'll have. You can learn more in the Insurance Denials and Appeals series in the Navigating CF playlist. If an employee loses their job and health coverage, or if a person with CF ages off of a parent's plan, COBRA may be an option. Short for the Consolidated Omnibus Budget Reconciliation Act, COBRA gives employees and their families the opportunity to keep their insurance for a limited time at their own expense. Since the employer no longer subsidizes the monthly premium, COBRA can be costly. However, it may still be a good option for those who are looking for coverage for a short period of time and have already met their deductible or out-of-pocket maximum for the year. Compass can help you understand your options for COBRA and plan for what to do when COBRA ends. Another commercial option is the health insurance marketplace. Sometimes called the exchange, it was established under the Affordable Care Act to help people who don't have access to an employer plan or who don't qualify for Medicare, Medicaid, or CHIP. Based on household size and income, marketplace plans can offer cost savings in the form of a tax credit to lower monthly premiums or specially designed cost-sharing reduction plans. Marketplace plans are sold on state or federal websites, but are offered by private insurance companies with a range of prices, premiums, and features. You'll want to be sure plans you may be looking at on the health insurance marketplace cover your CF providers and medications. There is a wealth of information on healthcare.gov, including how to find plans in each state. Those who are not eligible for or interested in premium tax credit through the health insurance marketplace may be able to buy insurance directly from an insurance company. These private plans vary in what services are covered and what they cost. You'll find information about private plans on insurance company websites. Compass case managers also can help you identify what plans may be available to you. Now, let's take a look at public or government health insurance programs. There are federal and state programs that provide health care assistance to qualifying families. The largest of these programs are Medicare and Medicaid. Government health care programs also include those you see here and others. In this video, we'll look a bit more closely at Medicaid, CHIP, and CSHCN. You'll find a complete video series on understanding Medicare in the Navigating CF playlist on YouTube. State-based Medicaid provides free or low-cost coverage for people who meet certain income and other requirements. These requirements, as well as coverage and programs, vary from state to state, and some have monthly prescription limits or limited provider networks. You may have heard the term Medicaid managed care. Managed care is when a health system tries to control medical costs by contracting with a specific network of providers. Sometimes this can impact what providers a person with CF can see. In some states, people with CF may not be eligible for managed care, or CF care teams may not be included in the managed care network. It's important to understand how the Medicaid program in your state works. Generally speaking, here are some common ways people living with CF qualify for Medicaid. You can learn more about eligibility requirements in your state by visiting Medicaid.gov. The Children's Health Insurance Program is usually known as CHIP, but may have a different name in your state. The program provides coverage to children and families with incomes too high to qualify for Medicaid, but do not have access to other insurance coverage. Some states also offer CHIP to women who are pregnant. To find out about Medicaid or CHIP where you live, you can search for your state on the Medicaid website or on insurekidsnow.gov. You can also call 877-KIDS-NOW, talk to your CF care team, or connect with Compass. Children with Special Health Care Needs is another state-based program available to children and in some cases adults living with CF. Some state programs have no age limit with certain genetic disease diagnoses, including CF, or have separate CF programs to supplement primary insurance for adults. CSHCN, which may have a different name in your state, is not full insurance coverage and is often limited to services related to the diagnosis. Some people with CF have more than one form of health insurance coverage. For example, someone may be eligible for both Medicare and Medicaid. There are strict guidelines when you have more than one kind of coverage, and benefits have to be coordinated between your primary and secondary plans. Compass case managers can help you understand coordination of benefits when you have more than one insurance plan. When thinking about health insurance for CF, there are 3 big questions to keep in mind. Is it accessible? Is it adequate? Is it affordable? The second and third questions here have their own videos in this Navigating CF series. As for accessibility, knowing dates and deadlines for enrollment is key to getting the coverage you need. The annual open enrollment period is a limited time when you can enroll in or make changes to coverage. It's important to reevaluate your options every year during this time to decide if your plan still meets your needs. In some states, if you miss open enrollment, you can't get or change coverage unless you qualify for a special enrollment period, which is based on a life event such as moving, losing healthcare coverage, getting married, or having a baby. You'll find a lot more about enrollment periods on cff.org/insurance. The important thing here is plan ahead. You may run into delays during the process, so it's best to start early so you'll be ready to enroll when you can. And remember, Compass case managers are ready to help you understand all the ins and outs and find health insurance options available to you. Connect with us whenever you need help.